Well, I see people are strolling in with their coffees and teas and such this morning. So thank you for joining us. We know this is the morning of the meetings where everyone starts feeling like this might be a bit of a marathon, but we're glad you're in the race with us. We just last night got the chance to celebrate a new set of fellows for our organization, but this morning is the perfect follow-on to that, and the fact that we get to choose a fellow who has been selected in the past to come and give us some of their insights and vision on a topic that's important to them and our field. So I couldn't be happier to be introducing for our fellows address a colleague and a friend, Jill McCluskey. Jill is a Regents Professor and Director of the School of Economic Sciences at Washington State University. Her research focuses on product quality and reputation, sustainable labeling, consumer preferences for new technology, and the representation of women in STEM. She's an award-winning researcher and has published over 120 journal articles and has 7,000 citations in Google Scholar. So make sure that our field is represented out there in the science as well. She's been funded by the NSF and USDA, and most impressive to me is the mentor that she has been to over 45 Ph.D. graduate students, which our own department benefits from with people that we've hired. We're excited to say she's also the incoming editor for our AJAEE, and has done almost every service role now, in the fact that she's also been a past president. So with that and no further ado, I look forward to hearing what she has to share with us this morning. And again, love that she represents our organization as a fellow. Jill, please take the stage.
Well, thank you so much for all of you for waking up early this morning after a fantastic night of reunions last night. I'm honored to be here in front of you today. This is my first in-person meeting in over 18 months, and it just feels great to say hello to people and shake your hand, give you a hug. I also want to commend the AEA leadership and staff on keeping the AEA strong during these challenging times. I especially want to call out Dawn Thomany McFadden for her leadership and her ability to solve problems. It's just been fantastic. So today I'll be talking about nutrition access, income, and race, and this is something that I've worked on in the last couple of years with some of my former PhD students, including Motorima De Amin, Syed Badrudoza, and Brandon Ware. And it's with a little bit of a heavy heart that Motorima is in intensive care right now for with COVID. So you should please keep her in your prayers. So what should I eat? It's an age-old question. It was for early humans, it was anything they could get their hands on that didn't make them sick. The question for many was finding something to eat rather than choosing what to eat. Before modern conveniences became commonplace, making a meal took a great deal of time and labor, and most people rarely went out to restaurants. Now, fast food is plentiful and extremely cheap with value menus. And at the same time, fresh produce and more healthful items are more expensive. So on this slide, we can all tell which side of the slide is healthful. Of course, it's the left side, but there are costs to consider. The less healthful side costs less per calorie consumed. It also likely costs less in other measures. The less healthful foods are often come prepared and are ready to consume. The more healthful foods need planning and additional and cooking. Then further, depending on where you live, the unhealthful foods be offered at a location that is nearby and convenient. What is more costly is the long-term effect of eating unhealthful foods on one's health. Humans usually have time inconsistent preferences, which means that when we're hungry, it's hard to resist the easy to access unhealthful foods. Thus, the location of healthy retailers can matter. So it's very well documented that there are significant health problems that come from not eating healthy diets. We can see in the figure here that it's everything from fatty liver disease to sleep apnea, heart disease, high cholesterol, diabetes, joint pains. All of these are caused by obesity. And it's also well documented that obesity is negatively correlated with income, and it's getting worse over time. So we see here's, oops. We see in the bottom one from 1990, the bottom line, that's from 1990, and it's very flat, and we can see that it's increasingly becoming negatively correlated. Obesity and income are becoming negatively correlated, and if I updated more, that we'd have even more of a slope. And so let's think about how do people choose their food? How does the retail food environment affect this choice? We know that taste preferences and culture, variety, and affordability of healthful food products often affect our food choices. I have a colleague, Adam Dranowski, who's at the University of Washington, so the state school that's across from Washington State University, and he's an epidemiologist, and it's funny that I'm an economist, he's an epidemiologist, he thinks that it's all about price. And I actually think it's a little more complicated than that, but Adam would argue, and has argued, that consumers are aware of the difference between healthful and unhealthful foods, and they would prefer healthful foods if the prices were the same. And so, grocery retailers can be a resource for providing healthful food. So then one question is, do low-income consumers have access to a retail food environment that provides a broad collection of affordable foods that constitute a healthful diet? And so then another variable to consider is how income is related to race and ethnicity. So household incomes have always differed across racial groups. And here I have a time series graph of it, and we see that for a long time, the Asian group has been the highest, and then white, not Hispanic. But the highest poverty rate is among the Black population, the Hispanic population. And since some race and ethnicity groups include households that have had less income over many generations, we can make the case that poor and minority consumers have had less access to healthful food retailers for a while. So another thing to consider is that inner city neighborhoods are often disadvantaged, and we see in the picture there's just a proliferation of fast food restaurants. And so health risks and resources are often spatially and socially structured in disadvantaged neighborhoods. And so then the diet-related health problems of individuals is often associated with the socioeconomic status of their neighborhoods. And there's often a greater proportion of non-white residents in these inner city neighborhoods. So although there is no universally accepted definitions for these terms, you'll often hear food deserts and food swamps. And just for convenience today, we'll say that a food desert has no healthful food retailers, and a food swamp has the unhealthful food retailers greatly outnumber the healthful food retailers. There was a paper by Cooksey Stolers in 2017 with co-authors, and they find evidence that the food swamps are a distinct and separate phenomenon to food deserts, and they are a much better predictor of US adult obesity than food deserts. So I put on my Homer Simpson glasses and want to think about this problem. So what I'll talk about today is a little bit of this work, and We have started to develop an economic theory about healthful and unhealthful store locations and consumer incomes. It will include both urban and rural populations. One concern is that causality could be either direction in the distribution of residents, and I'll discuss that in the next slide. And we also allow for heterogeneous transportation costs. Then I'll discuss a little bit of empirical work too, and one of them is a paper that has machine learning results, and we find the features of food deserts and food swamps in a data-driven manner, and then I'll also discuss some new research on where we're analyzing scanner data. So, healthful food access is really a complicated problem, and one issue is that in these socioeconomic deprived areas, healthful food choices decrease and prices increase, but the causality can go in either direction. And so the first one I'll focus on is that, at least in the theoretical model, is that nutritious foods often come at a premium price, and low-income households can't afford this. And this creates a disincentive for healthful food retailers to locate in those low-income areas. But it could also be on the other side of that, is that the lack of healthful food retailers in an area affects who chooses to live there. And so this is the Thibault insight and Thibault was looking at it with respect to public goods, and later we've discussed club goods in this area. But Thibault's insight is that if consumers are faced with choices of communities that offer different types of goods and services, then each consumer will choose the community that best satisfies their preferences. And then, but the implication of this is that there's a residential sorting, and we can see here I have Houston, and we have there's definitely residential sorting here, and Chicago too. There's definitely residential sorting that we have the low income, and then the Gold Coast has the high income. So, and it can even be in the same urban area. There's definitely low and high incomes in that. So I'll discuss a very simple model, a theory of food deserts and food swamps. And it's a simple version of a double differentiation model. The vertical quality is healthfulness of food. And so if you're familiar with a vertical quality attribute, it means that everyone prefers more of it to less. But some people are willing to pay more for it. And so the way that in this model, and what is often done, is that the willingness to increase and willingness to pay for it depends on income. The horizontal quality is the location of the store, and I'll consider a unit line. So we have a linear city that has both urban and rural sections, and the middle third of the line is urban. And just we decided that the urban part is 4 times as densely populated. We have end consumers, and we have both high income and low income, so just 2 types of consumers. And we assume that the low income consumers live on the left of a point M, which is in the urban area, and that's exogenous. So that I'm just assuming that the distribution of consumers is exogenous on the line. There are 2 retailers. One sells less healthful food, in that you could think of that as the fast food. And another one has more healthful food, and you could think of that as a full service grocery store. And so the assumption is then that the cost of quality, so that we normalize it as 0 for the fast food, is that cost of quality is 0 for that, and normalize it to 0, and for the grocery store it's C, which is positive. So then here we have what I'm talking about in terms of the distribution of consumers. And so I actually have a railroad track just to say that everyone on this side, so these are all the low income consumers, and these are all the high income consumers. And I put that because it's funny, actually in the town that I grew up, there was actually a railroad track, and you could be on the wrong side of the tracks. And so this is this exogenous, and it's just to make it simple that we can solve this. But and you see that the urban area it's 4 times as dense. So this is the from from 1/3 to 2/3, the density it's a uniform distribution at 2, and then these are a uniform distribution at 1/2. So the whole thing integrates to 1. So the game setup is in the first stage, the stores choose their location. The second stage, both stores choose prices to maximize profit. Both types of consumers can observe the location, prices, and healthfulness of the food, and that are offered, and they buy one unit from the store that gives them the greatest utility. And so to maximize profit, we first look at each store's market share as a function of prices. And so the consumer obtains a utility that is based on the location of the store, the level of healthiness, how much the marginal utility of the healthful food to them, and the prices. And so we assume this is the part that I was discussing that makes the difference between the low-income and high-income consumer. So theta, how much they value the healthfulness from the low-income consumer is equal to gamma times the amount of the high-income consumer. And that gamma is related to income. And the idea is that high-income consumers have a lower marginal utility of income because it's decreasing in income, utilities increasing in income, and so they're willing to pay more. And so to find the market share, we solve for the location of the indifferent consumer of each type, so of both low income and high income. We set the utilities equal from buying between store A and store B. And so we solve for the indifferent consumer, and you see it depends on the difference in the prices and the location of the stores. And so we can, since we know that the low-income consumer is located in the segment from 0 to M, we know that the indifferent consumer lies in that area. And similarly, for the high-end consumer, they're between M and 1. So the high and indifferent consumer is there. And so because of the different densities, there are actually 4 cases for this model, and it depends on the location of the indifferent consumer of each type. And don't worry, I won't spend a lot of time on this, but for these cases, it depends on, we need to, look at each case, and it could be oops. Okay. So for each case, it depends on the parameter. It could be that for example, in case 1, the indifferent consumer for the low income is in the rural area, and the indifferent consumer for the high income person is in the urban area. So there are these 4 different cases, and the demands are different for each case, and it's because we integrate add the 2 integrals to get the market share. And so then the profits are given by we multiply the number of consumers times the price times the demand for store A, and then for store B we have to subtract that price. And so each firm takes first order conditions with respect to prices, and they solve simultaneously to find their optimal locations. And then we can plug they give prices given their location, and then with backwards induction we can then solve simultaneously to get the locations of the two stores. So then the next thing that we can think about, we can extend this, and we can think about what if there are different heterogeneous transportation costs? So in that first version of the model, I just assumed that the transportation cost was 1. But let's say that the transportation cost for the low-income consumer is higher. And so the rationale could be that low-income consumers might not have access to a personal vehicle, or it might take longer. They have to go on public transportation. And then so we can include that there's some fee 1 that is the additional transportation cost that's greater than 1 for the low-income consumers. And then we can also solve for the indifferent consumers for each type. And so when we're thinking about this model, we can think about it in terms of how we might have a food desert and food swamp. So in this area, this rural area, if we have store A located here and store B located here, this area could be a food desert, and then this area that they just would be a food swamp. So just a very simple version, but thinking about how it might, what we might do with this. So this is still ongoing work. So we've done some preliminary simulation results. It's funny how these models, even though they're simple, they get complicated really quickly. So it's a work in progress. There are many parameters that we might want to vary. So it could be if M varies, and that's the proportion of low-income consumers, if the marginal cost difference for healthful food varies, if the transportation cost varies, or even how much people, the preference parameter, how much people value healthful food. So far, in the simulations that we've done so far, we found that the healthful food retailer never locates in the low-income region, and the less healthful retailer moves towards the high-income region when the city has greater areas occupied by the low-income consumers. When the low-income consumers have greater transportation costs, both stores move towards the low-income neighborhood, but both increase their prices. So this is just some preliminary results, but I think it's a way to start, that we can start thinking about the problem. Now we'll move to some empirical applications to think about this. There's two papers, one predicting nutrition access with machine learning, and we just published that this year in Food Policy, and then the second one is a project that we're just starting with using scanner data. So with this predicting nutrition access, it's another paper on food access. Why should we do another paper? Well, there's some disagreements in the literature. So first there's the concept of access. Is it distance-based? Is it geographic distance or travel time? And how are all these measures comparable? Is it a lot of studies don't have representative samples. They might use a household survey, but is it a small region? And how about the functional form? Are there omitted variables? So one thing that we did in this paper, we used this modified food retail environment index, and that was introduced by the CDC. We have a representative sample, and then we use machine learning, so it's data-driven and non-parametric. And so machine learning we think it's a good application for this problem. There's many factors that contribute to the retail food environment that are likely endogenous, and a parametric approach inherits the researcher's prior expectations, and so it imposes this structure on the data and may lead to functional form misspecification. The parameter approach does not accommodate high dimensional data and may suffer from omitted variable bias. And machine learning models don't impose or presume a formal structure, and they directly learn from associations between variables and the data. And so although they might use some hyperparameters such as number of trees and learning rate, these are optimally chosen over a broad grid, and hence it's really driven by the data. Machine learning may sometimes or often creates uninterpretable results and might have limited use for causal inferences, and Susan Athey has talked about that. But it fits our purpose of predicting retail food environment because the data is large and the predictors are very convoluted and endogenous. And so the definition of the retail food environment index, the CDC introduced it in 2011 with the Children's Food Environment State Indicator Report, and what it is it's the percentage of healthy food retailers in a census tract over the total number of retailers in a census tract. And so we define that a census tract is a food desert if the MFREI is 0. We call it a food swamp if it's between 0 and the median value, and we call it healthy if it's greater than the median value. And so in our data, the median value was 9%. So why would you use the median instead of the mean? It's supported in the literature, and it solves the imbalance problem with machine learning. And so we don't want to emphasize because random forest can underpredict rare events. And so the data sources that we use the USDA Food Access Research Access and the 2010 US Census. And so with this definition, this gives us 11,730 food deserts, 12,266 food swamps, and 26,216 healthful areas. And so this is just an overview of the method. I'm definitely not an expert in this, so this is Syed is the expert. I go along with it and I understand what it is, but I will not claim to be an expert in this. But our response variables are, we compare food desert with healthful, we compare food swamp with healthful, and we also compare deserts and swamps to see how they're different. The machine learning tools we use are random forests. And we do robustness checks with a gradient booster. So why use the random forest as the primary model? It's tree-based and intuitive, and it's faster in big dimensions. So we started out with 281 predictors, and with the random forest and the literature, we ended up with 10 final predictors. In the machine learning part, we started with 70% of our data to train the data, and then we validate it with and check it with the out of sample. And some of our performance accuracy was the Cohen's kappa for classifications, and we use normalized mean square root error terms. So just looking first at the characteristics of the food swamp, food desert, and healthful, we see that a major difference is the difference in population density. So the food swamp is by far the most dense, and food deserts are by far the least dense. Healthful are sort of in between. Also, interestingly, and this is partly what made us think about the transportation part, is that much more households in the food swamps do not have access to a vehicle in their household. And the other thing to consider is the food swamp has the lowest household income. Then there are more Black population and Hispanic population in the food swamps. And actually Asians are relatively, I should have had the Asian population is also highly represented in the relatively highly represented in food swamps. Okay. So random forest calculates an importance variable, or variable importance, I'm sorry, which is the increase in the mean squared error of prediction. And what I'm presenting right here is the Shapley values, which help extract the feature of food desert and food swamps and consider all combinations of predictors. And so it's interesting to look at the differences across a food desert and a food swamp. And so that what is important and what is important in each one. So we see that the food desert, the most important thing is that it's rural, and that it is a positive predictor. The most important thing for a food swamp is the negative, that it's not rural. We see that the second most important predictor of a food swamp is the percentage of Black population in the census tract. So it's interesting. There are very different food deserts, and food swamps are very different phenomena. So just a little bit more discussion on this. The food deserts are characterized by large rural tracts with low population density. They do have lower income and education, greater unemployment and inequality, but more access to vehicles and fewer SNAP recipients compared to tracts with good access to healthful food retailers. And people living in food deserts lack public transportation, so they need a car for their day-to-day. They have their own transportation. They lack public transportation. Black, white, and Native populations live in these tracts relatively more than other races. And in contrast, food swamps are characterized by smaller urban tracts. They have high population density. They have the lowest income and education, greater poverty, unemployment, and inequality. They have low access to vehicles and more SNAP recipients. And there's greater representation of non-white and non-citizens. So let's think about some of the policy. There are some policy implications of that. They are very different, and so there are different policies that are needed to address them. So since a major cause of food deserts is that they do not attract commercial healthful retailers owing to their low population density. So it might be something that we can facilitate community-supported agriculture in these areas where farms offer consumers regular deliveries of locally grown produce. We can do things like that. There can also be tax incentives and credits for grocery stores to locate in rural areas. Conversely, residents of food swamps, and there are a lot of Black and Hispanic populations in densely populated areas, mostly rely on public transportation, and they do not own their own vehicles. And there's more poverty, and there are many unhealthful options, so it makes them less likely to choose healthful foods. So they could be better served, food swamps could be better served if they had subsidized public transportation that considers the location of grocery stores. There could be tax incentives for healthful food retailers. And you could also regulate to limit the relative number of unhealthful food retailers in a specific location. So now I'll talk briefly about, we have a new empirical project that's using scanner data. And so there have been findings that exposing low-income households to the same products and prices available to high-income households reduces inequality somewhat, but only by about 10%. And so we were interested is the lack of healthful food consumption demand, how much of it is demand-driven given this finding. And so the objective of this study is to understand the factors that affect access to healthful food and the effect of access on health and nutritional outcomes at the national level. And so our research questions are then, how do socioeconomic and regional factors, including race and ethnicity, predict the establishment and closure and location of food retailers? And how does the location of food retailers affect residents' health and nutrition? And we're primarily interested in the impact of fast food restaurants and small convenience stores on health outcomes because they offer fewer healthy options and energy-dense food, as opposed to large grocery stores that can offer fresh fruits, vegetables, and dairy. And so here's our initial estimation results on this. We predict, we used logit regression, and we're using 2018 scanner data. And the three items that we were looking at is items with added sugar, chips, and soft drinks. And so we're interested in we're not only interested in the race variables, but we also interested in the food swamp and food desert, and then how they interact. And so we see that just by itself, the indicator variable for Black, that population is less likely to buy items with added sugar, more likely to buy chips, and less likely to buy soft drinks. And we see that in a food desert, if someone lives in a food desert, they're more likely to buy items with added sugar, they're more likely to buy chips, and they're more likely to buy soft drinks. So each one of those increases if you're in a food desert, increases those. For the food swamp, it's actually the first two are lower, and the third is soft drinks is not statistically significant. But then we add that if the interaction variable that is sort of, you can think about it as adjusting for this interaction of the Black consumer that is in the food swamp, and we see that those consumers are more like statistically more likely to buy items with added sugar, more likely to buy chips, but less likely to buy soft drinks. And for the Hispanic population who are located in the food swamp, they're more likely to buy items with sugar, more likely to buy chips, and not significant for soft drinks. So the summary of our preliminary findings so far is that we've found so far that the food purchase patterns do vary across racial and ethnic groups, and the tastes and preferences for healthful foods is heterogeneous across different groups. The interaction terms between race, ethnicity, and food access indicate that the food choices change due to the neighborhood food environment, so that, for example, that Black household buy fewer added sugar items in compared to white population in general, but they buy more when they live in a food swamp. And Hispanic consumers, on the other hand, buy fewer chips, but buy more when living in a food desert or a food swamp. So with this, our preliminary thinking about this is that the access to and share of healthful food retailers matters, and it has a heterogeneous effect. So then my concluding thoughts on this, and this is still a very open area of research, is that the promotion and achieving healthful diets among consumers is a really complex problem. And the nearby retail food environment differs both by income and by race. And policy should be developed to encourage ease of access to healthful food retailers. The policies should differ depending on whether the area is a food desert or a food swamp. And then I was also just thinking about this in this last point. So food culture, which is correlated with race and ethnicity, is likely to be important and can be an area of future research. And so just thinking about my own background, so I grew up with a lot of Swedish cooking in my family, and so we eat crepes, and this is rice pudding and all beige meals. So it's funny. So I grew up with these, but then I also grew up in California in the Central Valley, and there's lots of Mexican food there. So then I can eat really spicy food and my parents can't. And so I have not only my food culture from my parents, but then my food environment of where I grew up. And so Mexican food is great. I love it. All affected me. So it's interesting. I think it's interesting to think about all these factors and how it can help us think about these problems. So that is all for this talk. I wanted to thank my my former students who have worked on this with me. So Motorima De Amin and Syed Badriroza, they're both assistant professors at Texas Tech, and then Brandon Ware, who's an associate professor at Biola. So I'm open for questions, and then
Jill, we have a lot of questions online.
Okay.
We have one from Dave, and it says,
Okay.
did any of the counterintuitive findings, are there any real surprises? Did you have any counterintuitive findings?
Yeah, I'll through it, I guess. I mean, I didn't. Well, I guess the in the machine learning, I think that was not really counterintuitive. We sort of expected that food deserts would be rural, and food swamps would be urban. I'm a little bit already surprised by some of the findings in the scanner data that we had so I was surprised by some things that you might expect, that the effect of the food, both the food desert and the food swamp. So I would not have guessed all the signs and effects of that. So that for example, the Black population, the food swamp, actually drinks fewer soft drinks than not. So there's some interesting findings that I think that will, as we keep working with this scanner data, we can really target and understand a little bit better.
Mm-hmm.
Any more questions on?
Okay.
I think David has a question over there.
Mm-hmm. Okay, I really like the paper a lot. I like the conceptual model and the data and the results. I think that there are 2 or 3 things that are really important to analyze it to make it more realistic. The number 1 thing is time. I think that one reason that people will go to fast food restaurant is that they don't have time. So you'll have food swamp in places that people basically want to eat cooked food because they don't have time to cook. So that's the reason they go to whatever McDonald's or other things. So to some extent, introducing time is one thing. The other thing that I think is really, really important is access to some sort of medical access to doctors. I am now quite heavy. I would be 5 times heavier if it wasn't for my doctor. So to some extent, I can make case studies of members of the association, how medical treatment makes them drink less, eat more chicken, and basically last longer. So I think these are 2 points that are very important. The other thing that is really important is owning a car, because if you look at the history of food of the United States, Walmart basically, in my view, is contributing for the good, because it really eliminates all the really cheap liquor, gun store, cheap, low quality food in rural area and develop one large store. So the key element, owning transportation, access to transportation, that is very important. Now, the other thing is, I think it's really good. It's really good. I think it's very important that you have some sort of data about what people buy. And if you can even break it down to nutrition, it's really important to identify what are the nutritional deficiencies and the nutritional excesses. If you, like Lev LaFrance's dissertation, other dissertation show that despite of all differences in consumption, nutritional intake doesn't vary a lot. And I suspect that the main differences relate to overconsumption. But I think the modeling is fantastic, and I think this is a great start. Thanks.
Oh, thank you. So yeah, on responding to the time issue, that is, I brought that up in the beginning, but I didn't really include that in any of my analysis. But it might be something. When you were talking about that, I was just thinking about that. Single parent households, for example, have less time because they're likely working and have kids, and they have to quickly make a meal. So I could see that. I think that would be interesting to try to see how single parent households affects consumption. And we do, with the scanner data, we are planning to, we do have what people what people are buying, and we are planning to bring that together with health data. So, and I also like the access to doctors and insurance. And I was thinking about also access to insurance, not only access to doctors, but, you know, to healthcare coverage, because I do think that that at least can make you think more and be more cognizant about what you eat. So thank you so much.
Good morning, Jill. I just am sort of thinking about your problem here. I'm wondering about the role of social networks in both the role that some unhealthy food outlets, such as Quick Trips in small towns, may actually play. They do play an important role for like people to get together for coffee and things. And so there's I think some interplay there in sort of the creating social network cohesion. But at the same time, what I observe in rural areas that have been able to champion getting a grocery store that has vegetables in it and things like that is it's taken a lot of community support. And we've had some success too. We have a lot of communities in Wyoming that are very interested in forming cooperatives, and that takes a lot of social coordination and strong social networks. So, and when in some of those communities too, I've observed that local politicians have been very supportive too. So there's a political, like the political support, but don't have an easy answer on how to capture that. But it's just something that as you presented, it sort of provoked those thoughts. And as I was thinking about like what works and what doesn't, I think the social support works. So.
Yeah, great ideas. Thank you, Mariah. On the social networks, it did make me think of the fast food restaurants that have the kids' play areas. And I know that people who normally wouldn't go to McDonald's but would bring their kids there. And for example, in a college town, Pullman, where I live, it seemed like that sometimes when it's snowing and you just need to get your kids to burn off some energy, you might take them to run around in the play areas. So that's an interesting part that might get people hooked on fast food. And, you know, people who normally I would think wouldn't take their kids to fast food restaurants would, and it might be the start of a pattern that is negative. I also really like the community support, because I think, and I hadn't thought of that for in terms of for a policy initiatives that might, if that can be, we can think about how that might be implemented. So thank you. Okay.
Thank you for that talk. So I actually spent most of your presentation puzzling over the time series graph that showed the relationship between obesity and poverty, I think over 2 time periods.
Yeah.
And so in more recent years, it's a much strong, less pronounced correlation than it was in the past, right? And so I'm wondering what's changed that's made poverty so much more strongly correlated to unhealthy outcomes, right? Because I think that flat line you showed was basically when I was in college. I think.
So it's 1990 is the flat line, and I actually thought. So you're saying that it has increased more,
right? So
yeah, so that's what I was saying.
Yes.
Yeah.
So can your research findings mesh with that really intriguing time series graph that you showed in the beginning? I guess what's changed? It's not been that long since I went to college.
I think over time, food away from home just keeps increasing, you know, and now we've had a structural break with the pandemic, and who knows what will happen next. But that, I think that's part of it, that there are just so many options and so many high calorie, you know, ways to consume. Even thinking about everyone, you know, it's just normal for people to go to Starbucks every day and get a very sugary drink there. So I just think there's so many more options that are available and ways to consume it. And so I blame a lot of food away. I do blame a lot of food away from food away from home. But I'd be interested in, this is something that we're looking at more. I'd be interested in your ideas about that, if going forward.
Thanks, Jill. That was very thought-provoking. I have 3 comments. So one is on the time issue again. My wife works a lot with the Hispanic community in our community, and Hispanics, both husband and wife, are normally working 2 or 3 jobs a day. So they just really don't have time to cook a decent meal. So that's one effect there. The other thing I was thinking about, it would be really nice to do kind of a control experiment using another country. And I'm thinking in particular of France, which I know quite well. And the whole food situation there has dramatically changed over the last 2 or 3 decades. There are more McDonald's per capita in France than in the United States. And it's also had a big impact. The retail sector has had a big impact on the availability of good food in cities. People much prefer to take their cars to the suburbs, go to the hypermarché and buy everything they can in one single store. So it'd be interesting to just look at France as a kind of a control group to the United States and take away some of the, the cultural aspects that are specific to the United States, because I'm sure there's similarities there in terms of what you're trying to eke out.
Yeah, and I know that obesity is increasing worldwide, but has it increased faster in France? And I'm not familiar, just off the top of my head, with that.
It certainly has increased. I don't think it's anywhere near the levels here in the United States, but yeah. Okay.
Thanks. Yeah, and the Hispanic part is interesting, that they're working 2 or 3 jobs. The other thing that's a little bit different about the Hispanic family is you're more likely to have your extended family with you. So it could be, so it's interesting to think about that, because I know a lot of Hispanic families who have the extended family living with them, and it might be like the grandmother's doing a lot of cooking, home cooking. So it's interesting. Thank you.
If there's not one online, I wonder if the healthfulness of the diets in the rural food deserts is maybe underestimated, because it could be that there's a lot of people that are growing their own vegetables, or who have, a sibling or cousin or, neighbors that give them food. So I have to give this joke. The city cousin goes to visit the country cousin, and he remarks that he didn't lock his car door. He said, "Oh no, we don't have to lock our car doors, but you have to lock them in August." And he said, "Well, why in August?" He said, "Because if you don't, you'll come back and your car will be full of zucchini."
That's a good point. Thank you. I love the joke.
We have a question online from Norbert. How would the expansion of online grocers alter the results, especially given the expansion of SNAP purchases online?
So that's a great question, and I'm not sure at this point, but that's something that we should look into. So thank you, Norbert. I don't really know. I don't know enough about the online purchases to think about how the price of online versus in person. I don't really, haven't done it personally, so it's something to definitely look into, though. So that's something to think about for policies too. But if you're in a food desert, can you do online and get fresh produce delivered to you? I don't know. But it's something to think about. So thank you, Norbert.
Hi, thanks very much for a great presentation. I'm curious, I know it's a little off different focus, but I'm wondering if you could comment on the potential impact and role of education programs like FNAP, and how they may play a role in some of the food choices.
Yeah, yeah, I'll deflect this one to Dawn. Yeah.
Yeah, absolutely. I'm just wondering, you think about programs that the federal government is supporting, and there's a lot of investment in things like FNAP to try to drive better food choices. And it would be interesting to look at whether they're effective in food swamps and food deserts, and if there's any difference.
Yeah, that sounds like a great area. We did have education as a variable, but we were more focused on income, and there's a correlation, of course, but so I haven't specifically thought about that much, but it's definitely an area to look at. Thank you.
Great. Thank you.
So, Jill, sorry, I don't know if there's a question online, but if not, so I know you mentioned that you control for socioeconomic characteristics, and I was wondering whether, once you control for those, do you still find the strong effect of race, or how much of it is because of income and education, irrespective of race, and how much of it is just race, and if you have some reasons or explanation for one way or the other, what you find?
In the scanner data or in the machine?
I was looking at the data, at the results that you're showing here.
Yeah. So we did control for education and income, and we still have these effects. But this is very preliminary, and so I wouldn't make super strong predictions just on this, but we did control for those, and we still have the rate, the significance on certain variables. Yes, David.
Okay, I'm sorry to ask this one. I think there are two factors that are really crucial. The number one factor that people don't speak a lot about is if you have a family or not. Single people that got divorced, widowers, whatever, kids without kids, generally are really in tough shape because they have to eat themselves. They don't like to cook. So to some extent, a family status is really, really interesting. I generally like to look at food as function of the production function of health, and how it affects life expectancy. So generally, if people get divorced and don't have new relationships, that's one problem. Secondly, all the food and vegetables and fruit and all these nice things are irrelevant compared to one thing called alcohol. So I think that is a very important element to look at alcohol. To me, the theory is very simple. Some people have too little time, so they eat junk food. Some people have too much time, so they drink alcohol. So to be able to manage your time is the number one thing that I think beyond everything else. But I think really looking at family situation, at trying to get information about alcohol consumption is very important because alcohol also affects obesity and affects other things.
Yeah, great points. So, and I was thinking about, in response to your first question, I was thinking about how the single parent family would have less time, but then also someone who is we have more people living in a single household than ever before. And it could be that, some of those meals might be pretty sad, that they are just making something, microwaving something or going through a fast food line. And it's because you might not have the joy of a meal with your family and friends. So it's a good point. So I will definitely look at family structure, and then alcohol is a good point. So it's easy to get a lot of calories from alcohol. So so last question, and then Dawn. So last question, and then I guess we have. I don't know, Dawn. Do we have time for two? Okay, and then Dawn will make it. Dawn wants to make a few announcements for the rest of the day.
Well, again, thank you very much, Jill. Great presentation. Lots of good thought-provoking stuff here. Magnitudes matter, right? So how important is access? How important is price relative to everything else? If you're saying that on the one hand that There's some evidence that access and price only matter marginally. Are there different interventions that might be a better way to spend our public dollars to try to address these problems? How do we get at those sort of questions?
Yeah.
How do you make me eat better?
And as I was saying, that this is a very complex problem, and that it is interesting to think about that humans have time inconsistent preferences, and so often we do the convenient thing, or if we're hungry, we'll go for the thing that tastes good right now, and often proximity matters. So I do think it's important, but I need to think more about how we can weight the different factors.
Thank you, Dr. McCluskey. This was great. So I had a thought on your first theory about when you choose between store A and store B, you're essentially choosing something like a Whole Foods versus maybe like a Golden Pantry where you're just getting something convenient. So have you also thought about, like, you're taking Walmart versus Whole Foods, where Walmart might have choices of healthy foods available. So a person is not having that disutility of whether you need to go to Whole Foods. I don't know what to do with the Whole Foods, but at least in Walmart, you're going there, you can actually just survey like a packet of quinoa, which I don't know what to do with it because culturally I've not grown up, so I don't know what to do with it. So you go and you read the packet, okay, this is how you cook. So you inform yourself. So maybe this is like future work where you can build in like a uncertainty of information or what you have, because this comes to the point you made about your colleague who believes that everyone knows it's healthy food, but it's about, okay, we all know it's healthy, but how do I prepare it? And the other thing was following up with Dr. David. NBR last week had from University of Houston, Ellen Liu, who also used the scanner data about the mailability of alcohol consumption. So that's one paper you could refer to, where she's looked at how migrants have traveled from one state to other and how their consumption of alcohol changed moving across states. Yeah, that's my thought.
Yeah, very interesting. Both good points. I will check out that MBR paper. So that sounds great. I have to say though that I know, so in Walmart you can get both healthy and unhealthy. It's a full service grocery store, but I think you can also get unhealthy things at Whole Foods too. You know, I've been there before. So yeah. Okay. Well, thank you.
Yeah, and thanks for such an active set of people watching from online. I'm sorry we didn't get to all of your questions, but we'll make sure Jill gets a chance to see those and respond to you. Happy to see you all joining us virtually, so thank you for that. As we break and prepare for the second day, you know, just a couple notes as we continue to learn with this grand experiment, I call it. If you're going into rooms, and if you can be the advocate for the rooms you're in, some of them do have a professional set of people helping with Zooms and so forth. But in some cases, it's as easy as within the app, whether that's on the computer or your phone, there is a Zoom link. And if people, because we've had to put together this kind of hybrid so quickly, if you guys can kind of advocate for helping jump up to the computer if there's any confusion, we do have Zoom links in all those rooms. I guess some of them aren't getting open so that people who are trying to watch online can. Luckily, we have lots of other choices, so they're jumping to the other choices. But as we learned from this, we didn't realize people had kind of not understood that maybe sometimes it's just going into that app you all probably have on your phone or computer when you built your program and just starting up a Zoom. So if you can advocate for helping that to happen. And again, thanks for all your grace and patience as we learn how to put on a program like this. But as you can see, we continue to know we're getting lots of good quality content shared throughout it. So we hope this day goes well for you all. Please do join us as we wrap up this afternoon for Gita Gopinath, who will be giving the Galbraith lecture, and that will be wrapping up our full meetings for this afternoon. Of course, there's some post conferences. So I hope to see you back in the this room one more time, and that's for Gita, who will be joining us virtually, but we'd love to see a good crowd then. Go enjoy your day, and we'll be starting up again with sessions at 10 a.m. And again, for those of you online, we'll make sure Jill sees the questions we didn't get to, but thank you for being an active and curious audience. See you later this afternoon.